medical student, and now I'm going to assess my patient's peripheral vascular, neurologic, and musculoskeletal system. So before proceeding the assessment, make sure to provide the client's privacy. Introduce yourself to the client, explain the procedure to the client, and also don't forget to wash your hands. Hi, good day sir. I am Carla, your student nurse, and I will be doing your assessment today. So I will be checking your musculoskeletal, your neurologic, and your peripheral vascular if there's any abnormalities on it, okay? So can I hold your hand to check for your response? Okay, kindly state your name and your birthday, please.
I'm Bernard Veteran and my birthday is August 13, 2013.
Okay, thank you. So now we're going to assess our patient's mental status. So sir, kindly answer these following questions honestly, okay? Okay, so sir, where are we now?
In the house,
Okay, sir, what time is it?
10:30 in the morning.
Okay, so do you feel dizzy right now or do you feel like pain right now?
No,
Okay, so I'm gonna ask you, who is the president of the Philippines?
President Rodrigo Duterte.
Okay, thank you. So now kindly tell me your explanation of this proverb, the early bird catches the worm.
First come, first serve.
Very good. And now kindly repeat after me, okay? Inward is handsome.
Inner is handsome.
Okay, very good. So now we are going to test the cranial nerve functions. So I'm gonna ask my patient to close his eyes and smell what it is. So first, kindly take off your mask, please. Okay, so now kindly close your eyes and tell me what you smell, okay? Okay.
Next.
What?
Next.
Okay, thank you. And now we're going to check his visual acuity and pupil constriction. So now let's start for the visual acuity. So kindly stand up, please. Stand up, please. Okay, can you turn around and look on the Snellen chart? And now what you're gonna do is to cover your right eye first. And now tell me what number did you see in the Snellen chart?
7.
Okay, so number 7, dictate what letter is in there.
FENOPZD.
Okay, thank you. And now let's proceed to your left eye. Cover your left eye. So now tell me what number did you see?
7.
Okay, dictate it.
FENOPZD.
Okay, very good. And now we're going to proceed to the pupil constriction. And I will use this pen light. Now kindly follow this pen light, okay?
Okay.
Okay. Okay, good. Now I'm going to check your eyes. Kindly open it. And the other one. Okay, good. Now we're going to assess our patient's facial expression, which is cranial nerve number 7. So kindly smile to me, puff your cheeks, frown, lift your eyebrows. Okay, very good. So now I'm going to check his test hearing. So I'm gonna cover your ears, and then I'm gonna whisper you and tell me what you hear, okay?
Okay. Beautiful.
Okay, good.
Handsome.
Okay, very good. And now I'm going to check my patient's blood reflex by touching his posterior pharynx with the tongue depressor. Okay. So this might be uncomfortable. Is it okay with you?
Okay.
Okay, so kindly open your mouth. Okay, very good. And now kindly shrug your shoulders. Okay, and put your hands on the left and right cheeks to the patient and ask the patient to push it. Okay, kindly push it. Very good. And now kindly move your head side to side like this. Okay, very good. And now kindly touch your ears on your shoulder. And now kindly touch your chin on your chest. Very good. And lastly, kindly look up on the ceiling. Very good. So now we are going to inspect our patient's upper extremities. So we are going to look if there's any lumps, swellings, or any lesions. Okay, may I see? Okay, so there's no any lumps. They are normal. Next thing we're gonna do is to ask our patient to extend their arms forward and turn their palms up and down. Can you do it like this? Very good. So I'm gonna check his strength. So kindly I'm gonna put my hand on your arms And then try to push me. He's so strong. And now I'm going to inspect his hands and his elbows. If there's any lesions, so there is no lesions. And now we're going to palpate his elbow and his hands. If there's any masses or lumps, tenderness, do you feel tenderness? No?
No.
Okay, very good. Now, gonna move this. Okay, good. Now I'm going to palpate my patient's radial artery and brachial artery. Okay. The other side. The other side. Good. They are 2 plus and which is normal. Now I'm gonna ask my patient to squeeze my hands. So kindly squeeze my hands as hard as you can. Oh, you're so strong. Now I'm going to ask my patient to cover his eyes and tell what they see. Okay, so kindly cover your right eye first. I'm gonna cover my left eye too. And look at this eye and don't look at this finger. So tell me what number did you see, okay?
Okay.
Okay, start.
1, 2,
Okay, good. Now let's do to the other eye, your left eye and my right eye. Okay, so start.
1, 3.
Okay, very good. And now I'm going to ask my patient to close his eyes and tell me what number did I write on your palm. Okay, so close your eyes and give me your palm. And then tell me what number did I write.
7,
Okay, good. How about this one?
2,
Very good. And now I'm going to assess my patients in a supine position. So kindly lay down, please. And now we're going to inspect his lower extremity. Now I'm going to inspect his legs and his feet. And I'm going to see if there's any rashes or any kinds of lesions, edema or varicose. So there's no lesions on his feet. And now we're going to press the pretibial area and we're going to see if there's any edema. Okay, so there's none. There's no edema. And now we are going to palpate his popliteal fold, so which behind his knees. So gonna rate it. Okay, they are 2 plus, which is normal. I'm gonna palpate the other one. So okay, they are 2 plus, which is normal too. And we're going to palpate his temperature. Okay, so they are normal. And the hair growth is normal too. So now we're going to feel the pulses on his feet. And we're going to feel on the posterior pretibial. Okay, they are normal. And we're going to feel with the dorsalis pedis. And they are normal too. And we're going to press his toenail and see how fast it comes back. Press in 2 seconds and see how fast it comes back. And the other side. And they are normal. So now have the patient perform the straight leg test with his one leg. So kindly. Okay, good. Now I'm gonna ask my patient to move one laterally with her straight knee. Okay, kindly move. Good. Okay, very good. Thank you. And now I'm going to assess my patient's deep tendons reflex and we're going to use this hammer reflex. So let's start with the bicep reflex here. Then 1, 2, 3, go. Okay, good. And second is a tricep reflex. 1, 2, 3, go. Okay, good. And the third is here. We're going to 2 cm. 1, 2, 3, go. Okay, good. Now we're going to the patellar reflex right here. Okay, 1, 2, 3, go.
This is the Achilles.
Here, and we're going to like this. And 1, 2, 3, go. Okay, good. Now we're going to stroke the sole of the foot of our patient with the end of the reflex hammer handle. Okay. Okay, good. So now we are going to ask our patient to dorsiflex and plantar flex his feet. Okay, dorsiflex, plantar flex. Okay, good job. So now I'm going to assess my patient in standing position and now kindly walk regular or normal walk. So next is kindly walk tiptoe. Okay, next is your heel. Walk with your heel. Okay, thank you. Next is the Romberg test. So what we're gonna do is to close your eyes, put your hands on your side, and then wait for 20 seconds. I'm gonna assist my patient if she is weighing or imbalance.